Good morning, everybody. Dr. Stephen Zahm here with another episode of Tooth Teacher Tuesday. Um, you may or may not know this, but we record these things a couple weeks in advance. So right now I'm coming to you from my home office. We're on vacation this week. I'm here with my little co-star Thor. Hi, Bubba. And so yeah, let's jump into this week's topic. Kind of a follow up to what we talked about a couple weeks ago, as far as we talked about when children's first visit to the dentist should be. This week's topic, by special request, is to give some tips about how can we avoid instilling dental fear in our children. And great question, very important one to me because that's the biggest barrier to seeking dental treatment is just fear of the dentist. And study after study has shown that most dental fear is not learned in the dental office. It is kind of learned secondhand, just being told that the dentist is something to be scared of, oftentimes before even the first dental visit. So some great tips to avoid having your child develop any dental fear would be, first and foremost, what we talked about a couple weeks ago, which is get your children into the dentist at a younger age. The earlier they get in, the more experience they have with the dentist, the less likely they are to develop that fear. And the earlier we can catch, small cavities and other issues before they become a bigger thing that may be more traumatic for the child. Some other great tips, like I said, dental fear is oftentimes taught through others. So a big trick is, a lot of children learn that fear from being told by a parent or sibling or another child at school that, hey, the dentist is a scary place. You're not going to like it. They're going to hurt you, so on and so forth. So big trick is just, if you as a parent have dental fear, no judgment, not going to come down on you at all, but try not to pass that fear on to your child. And I just mean to say that put on that brave face, pretend like you're not afraid of the dentist, and there goes my co-star. Same thing if your child has an older sibling. Obviously, if you catch it with the oldest sibling, it may be less of a problem with the younger ones. But let's say you had an older child that had to get a cavity. Just try to keep them from talking about it with their younger siblings, just so that fear doesn't get passed along. Obviously, there's only so much you can help, especially if your child hears it from another child at school. Then, you can't be on top of them 24/7, basically. And it goes so far as, we at our office, we don't use any words with negative connotations at all. We don't use the word pain, hurt, shot, needle, cavity. We basically avoid any words that sound scary to a child. That's not to say that we don't see these things, but we don't tell a child that they're getting a shot. We just, for example, we say that they're getting sleepy juice that's going to make their tooth sleepy. We don't even use the word numb. And like I said, if you avoid those negative words, both us in the office and you as the parent at home, we're setting that child up for more success. And then I would say probably the other biggest thing, actually a couple things come to mind. One would be, if your child already has some dental anxiety, like if they've got a loose tooth and they don't want to wiggle it out, the worst thing you can do is pin them down, force it out, tie it to a string and door and try and get it out that way. I won't say always, but most of the time, if it's like a loose baby tooth, it's not anything urgent. Obviously, if it's an exception to that rule, your dentist will tell you that. But most of the time, it can wait. If your child is scared of having that tooth out, just let nature take its course. They'll bite into a piece of food and it'll come out and they'll be fine. It's much better than potentially traumatizing them by holding them down, wiggling it out, because then they're going to be scared of you, but they're also going to be scared of anything going on with their mouth. And then that kind of extends to anything dental related. Um, I would say if they're afraid of you brushing their teeth, you got to get in there, but try not to be too aggressive. Just little baby steps. Even if they let you brush for 5 seconds, hopefully the next day you can get it to 10 seconds until you're able to get to a place where they're letting you brush consistently and thoroughly. Final tip that I have for reducing fear in children is to not set them up for being afraid by treating the dentist as a threat. What I mean by that is saying something along the lines of, oh, if you don't brush your teeth, you're going to get a cavity, and then the dentist is going to have to numb you and drill your tooth. And when you do that, obviously you're right, but you're setting us up as the bad guy. We're just trying to fix the tooth. And yeah, that involves drilling and numbing and all that stuff. But if you're threatening the child with coming to the dentist, that makes us sound like a bad place that they want to avoid. Whereas, if you just put a positive spin on everything, kids really respond to that. So even if your child has a dental visit and it has no cavities, reward them with something. I wouldn't necessarily bribe them beforehand, but if they do well, reward them afterwards so that they're associating their good health with something good, rather than being punished by the dentist for having a cavity or something like that. So again, just a couple thoughts there. I would echo what I said a couple weeks ago. Ultimately, when it comes down to it, you're the parent, you know your child best. So, take all of this advice as needed to fit your parenting style. But just some food for thought. I guess that'll be it for this week. I'd love to hear more suggestions for topics, more questions, more feedback. So, in the meantime, hope everybody has a great Tuesday and a great week, and we will see you next week.